mynews.studio.
A new study suggests that most liver cancer deaths could actually be prevented using tools we already have. So the question is, why aren't we putting them into practice?
Today is August 1st, 2025. Liver cancer is now the third leading cause of cancer deaths worldwide, isn't it? We're talking over 1 million lives lost each year. What really stands out is how much of this could be prevented, especially in low and middle-income countries.
That's right. The main drivers are chronic hepatitis B infection, alcohol overuse, and unhealthy diets. And here's the thing. We've had a safe hepatitis B vaccine since the 1980s, but coverage, especially for the birth dose, still lags behind in the very places that need it most.
And that's exactly what this new analysis in the Lancet focuses on. If we combine hepatitis B vaccination, healthier diets, and reduced alcohol use, up to 60% of global liver cancer cases could be prevented. Did you see the data from China and Africa on birth dose vaccination?
I did. Vaccinating newborns can reduce liver cancer rates by as much as 72%. That's huge. Yet, in 2022, fewer than half of all newborns received that crucial shot. So we're leaving millions at risk, even though we know how to prevent it.
So why is birth dose coverage still so low, even when the benefits are so well documented? Is it only about logistics?
It's a few things. Not every country requires universal birth dose vaccination within 24 hours. Then there's the challenge of cold chain logistics, keeping vaccines at the right temperature, which is hard in remote settings. And fitting hepatitis B into existing immunization schedules takes both funding and political commitment.
But the recommendations don't stop with vaccination, do they? There's also talk of minimum alcohol pricing and lifestyle counseling. How does minimum pricing actually work?
Governments would set a minimum price per unit of alcohol, which makes the cheapest, highest-risk options less available. Add to that restrictions on advertising, sales hours, and points of sale. The goal is to make healthier choices more accessible.
But is this realistic in countries with fewer resources? Can outside help really make a difference?
Yes, international organizations and donor governments can step in. They can subsidize vaccine costs, support cold chain infrastructure, and train healthcare workers. Regional vaccine production could also cut costs. And then there's public education and policy advocacy. Those really matter.
So if we're talking about coordinated global action, things like pooled vaccine purchases, even linking debt relief to health investments, could that actually move the needle?
It could. Sharing best practices is key too. For instance, China's universal birth dose program could serve as a template for sub-Saharan Africa and other high-burden areas.
What about on a personal level? Is there anything individuals can do to lower their own risk?
Absolutely. People should get vaccinated against hepatitis B, limit alcohol, eat a healthy diet, and go for regular checkups if they have risk factors. Personal choices matter, but system-wide change is what really shifts outcomes for millions.
The estimates say that if these strategies are rolled out, we could save between 8 and 15 million lives over the next 25 years. That's a huge impact.
Yes, the hepatitis B vaccine is now considered the world's first anti-cancer vaccine. The challenge is scaling up in places with fewer resources, but the evidence is solid. A coordinated effort could make liver cancer one of the first major cancers we actually prevent worldwide.
And maybe this could set a precedent for other diseases where prevention is possible, but not yet widely achieved.
So, to recap, we've talked about how hepatitis B vaccination, alcohol control, and dietary improvements could prevent most cases of liver cancer. We have the tools. The hurdles are really about funding, logistics, and political commitment.
Will governments and global organizations take action? That's what we'll be watching. But the roadmap is clearer than ever.
Thanks for listening as we explored this potential turning point in global health.
Thank you for joining us. This episode is brought to you by mynews.studio. You can try it now for free.